Hi there, Mr. Jarvis. My name's Dominic. I've been asked by one of the consultants to talk to you. I'm a medical student.
Okay.
How are you today?
Yeah, I'll be honest, I've been better, you know. From what I've been told, it was quite a nasty fall, you know.
Birmingham's been involved in simulation for a long time, initially role-playing back in the early 90s and then extending into other kinds of role-play and simulation using what we now call associate clinical educators, teaching intimate examinations, helping students to learn to deal with difficult situations.
The first medical role players were trained and introduced to the curricula MBCHB in 1991. Primarily the team was introduced to look at clinical communication, so situation management with patients, relatives, advocates, and more recently professional colleagues. Scenarios are pre-designed for certain parts of the curricula where we're mapping onto the objectives of a particular module.
So in first year we had to break bad news, basically the fact that they had cancer, which was quite difficult to do for our first time. For instance, if it's an angry patient, you feel like it's your fault that they're angry and you kind of almost take it personally when you shouldn't.
It feels very, very real. But for me, I feel like it was a good experience. So it was good to take criticism and feedback from that.
The really important thing about all form of human simulation is it must be authentic. If you don't use people that are professional, external and highly trained to do that, you run the risk of a session that doesn't reach its optimal level of use or value.
We'll get a scenario given to us and then we'll need to flesh out that character. And the way that we're doing that is we're trying to think about all the things that happen that bring the person to where they are at that moment in time. The best outcome is when the student learns from it, and the only way that can happen is if we're giving them good feedback.
Simulation helps students because they can practice, they can get it wrong, they can learn from getting it wrong, and they get immediate feedback and they can keep working at it.
It's good to actually apply some of the things that you've learned and see how what you've learned in lectures will actually apply in a real clinical setting, I think. And it's good to just make mistakes in a safe environment.
We started with simple role play, which pretty well everybody does, but we've gone way beyond that now. And so we're doing something that's innovative, leading edge, and pretty special, I think, here at Birmingham.